So lying down, making yourself comfortable, lying on your back, on a mat, or on a rug on the floor. Allowing your eyes to gently close and bringing the arms alongside the body with the palms open to the ceiling, legs outstretched, ankles uncrossed. Take a moment to feel the body as a whole right now. Taking a few moments to get in touch with the movement of your breath and the sensations in the body. Bring in your awareness to the physical sensations in your body, especially the sensations of touch or pressure where your body makes contact with the floor. On each out-breath, allowing yourself to let go, sinking a little deeper into the mat or floor. Reminding yourself of the intention of this practice. So the intention of the body scan, its aim is not to feel any different, relaxed or calm. This may happen or it may not. Instead, the intention of the practice is, as best you can, to bring awareness to any sensations you detect, as you focus your attention on each part of the body in turn. If you find yourself falling asleep, you might find it helpful to prop your head up with a pillow, open your eyes, or even do the practice sitting up rather than lying down. Now, bring in your awareness to the physical sensations in the lower abdomen, becoming aware of the changing patterns of sensations in the abdominal wall as you breathe in and as you breathe out. Taking a few minutes to feel the sensations as you breathe in and as you breathe out. Having connected with the sensations in the abdomen, bringing the focus or spotlight of your awareness down the left leg into the left foot and out to the toes of the left foot, focusing on each of the toes of the left foot in turn, bringing a gentle curiosity to investigate the quality of the sensations you find. Perhaps noticing the sense of contact between the toes, a sense of tingling, warmth, or no particular sensation. When you are ready, on an in-breath, feel or imagine the breath entering the lungs and then passing down into the abdomen, into the left leg, the left foot, and out to the toes of the left foot. Then, on the out-breath, feel or imagine the breath coming all the way back up, out of the foot, into the leg, up through the abdomen, chest, and out through the nose. As best you can, continue this for a few breaths, breathing down into the toes and back out from the toes. It may be difficult to get the hang of this, but just practice this breathing into as best you can, approaching it playfully. Now, when you're ready, on an out-breath, let go of the awareness of the toes and bring your awareness to the sensations on the bottom of your left foot. Bring in a gentle, investigative awareness to the sole of the foot, the instep, the heel. Noticing the sensations where the heel makes contact with the mat or floor. Experiment with breathing out the sensations, being aware of the breath in the background as in the foreground. You explore the sensations of the lower foot. Now allow the awareness to expand into the rest of the foot, to the ankle, the top of the foot, and right into the bones and joints. Then take in a slightly deeper breath, directing it down into the whole of the left foot. And as the breath lets go on the out-breath, let go of the left foot completely and moving to the lower left leg, possibly feeling the contact of the leg with the mat, aware of the skin and the calf muscle, the shin bone, any sensations in this part of the body. breathing into the calf, the lower leg, and breathing out. Letting go of awareness of the lower leg. Moving to the left knee. Circling the knee joint with your attention. Exploring the kneecap, the cartilage, the hinge joint, and the underside of the knee. Aware of any sensations here. The mind will inevitably wander away from the breath and the body from time to time. This is entirely normal. It's what our minds do. When you notice it, gently acknowledge it, noticing where the mind has gone off to, and then gently return your attention to the part of the body you intended to focus on. And on an out-breath, letting go of awareness of the left knee and coming to the left thigh, becoming aware of the skin and muscle, perhaps feeling the pulsation of circulation here. There may be feelings of heaviness or weightiness. Feeling the contact of the thigh with the surface that you're lying on. Aware of the thigh bone as it rests in the hip socket. Continuing to bring awareness and a gentle curiosity to the physical sensations in each part of the body. Bringing the detailed level of awareness and curiosity to the body sensations that are present. When you become aware of tension or any other intense sensations in a particular part of the body, you can breathe into them using the in-breath, gently to bring awareness right into the sensations. And as best you can, have a sense of letting go or releasing on the out-breath. Bringing attention now to the place where the left thigh bone rests in the hip socket, and spanning your attention across the hips and all the way down the right leg to the right foot, and now to the big toe of the right foot. Noticing any sensations here, perhaps coolness, dryness, moisture, tingling, or nothing at all. Noticing what's happening in your body right now. And moving attention now to the other toes of the right foot. The toe next to it, the middle toe, the toe next to it, and the little toe. The skin and nails, the spaces in between the toes, including all sensations. And on an out-breath, letting go of awareness of the toes, and coming now to the ball of the right foot, and the arch, and the heel. Aware of the skin of the heel. Now coming to the top of the right foot, including the skin and the bones. and expanding the attention to include the entire foot, the muscles, the nerves, the blood vessels, all sensations. Breathing into the right foot and breathing out. Letting the foot go. Focusing now on the right ankle. Aware of the bones and the skin, the tendons. The feelings of contact the ankle makes with the surface that you're lying on. And on an out breath, letting go of awareness of the right ankle and coming now to the lower right leg. Aware of the calf muscle, the skin, the shin bone, possibly feeling pulsations of circulation. And on an out breath, letting go of awareness of the lower leg and moving the attention now to the right knee and exploring the right knee. So taking all of your attention and placing it right in this one part of the body. Noticing sensations on the underside of the knee. Circling with your attention the knee. And on an out breath, letting go of awareness of the knee and moving now to the thigh, to the right thigh, exploring the muscle, the skin, bringing attention now to the hip bones, the entire pelvis, possibly aware of the organs held in this part of the body, the reproductive organs, the bladder, the buttocks, feeling the contact of the buttocks and the lower back on the surface that you're lying on. Noticing any sensations here, perhaps feelings of weightiness, perhaps feelings of lightness. The mind will inevitably wander away from time to time to thoughts, daydreaming, planning, worrying, just drifting along. This is not a mistake or a failure. It's simply what our minds do. When you notice that your mind has wandered, just acknowledge where the mind has gone off to. And without any judgment, and in a kindly way, return your attention to the part of the body that we're examining. So letting awareness of the pelvis go on an out breath and moving the attention from the lower back up the spine, being aware of each vertebra of the spine, aware of the intricate nerves protected and encased in the spine as they branch out to all parts of the body, aware of the muscles and the skin of the back. Moving further up the back to the middle of the back, possibly aware of the kidneys. Moving further up the back, aware of the ribcage. Maybe feeling the ribcage expanding with each breath. Aware of the place where the ribcage attaches to the spine. The back of the heart. The back of the lungs. The shoulder blades. Drawing attention all the way up to the place where the spine meets the skull. And on an out breath, letting go of the tension of the upper back, the chest, and moving the attention now to the abdominal region, aware of the stomach, perhaps feeling sensations of digestion, possibly aware of the liver, the pancreas, aware of the intestines, feeling the movement of the abdomen as it rises and falls with each breath. Taking a deep breath in, allowing the abdomen to really expand on the in-breath as the diaphragm muscle pushes down, creating more space for the lungs to hold air. Noticing how the abdomen rises as the body is filled with fresh oxygen. And then releasing, breathing out, noticing the abdomen deflating, flattening. Moving attention now to the chest, to the front of the chest. Feeling the expansion of the rib cage with each in-breath. Feeling the rib cage expand in the sides and the back. Aware of the heart cradled between the two lobes of the lungs. Noticing the close work of the heart and the lungs. As the lungs draws in fresh oxygen, the blood takes it to all parts of the body and then returns what's no longer needed to the lungs, and the lungs release that. Perhaps feeling right now the beating of the heart, the movement of the lungs. Aware of the muscles of the chest, the breasts, the skin, noticing the skin, the collarbones, and breathing into the entire chest allowing the rib cage to expand fully on the front of the sides and the back. Aware of any emotions that may come up in this part of the body. So often we talk about something being heartfelt or having a gut reaction. As we go through the body, we may notice different feelings come up. And noticing whatever feelings come up, whatever sensations, whatever thoughts. Breathing into the chest and breathing out. On the out-breath, completely letting go of this part of the body. And we draw the attention now down both arms to the fingertips of both hands. Aware of the sensation of air touching the fingertips, possibly feeling moisture or dryness. Aware of the skin of the fingers, the fingernails, the joints of the fingers, the knuckles, the palms of the hands, the back of the hands. Aware of the movement that is capable with our hands and the work of the hands. Breathing into the hands and breathing out and moving the attention to our wrists. Aware of the bones, the skin, possibly feeling the pulsation of circulation here as the blood vessels interlace at the wrists. And on an out-breath, letting go of awareness of the wrists and moving up to the lower arms. Aware of the skin, the muscles and the bones. And now coming to the elbows, noticing any sensation in the elbows, the rougher outer skin and the delicate skin on the inside of the elbows, of this hinged joint. Moving further up the arms, aware of the skin of the upper arms, the muscles, the armpits, aware of the upper arm, the way the bones come together at the shoulder joint. Aware of the top of the shoulders, the sides and the back. Noticing the muscles here. Really exploring any sensations in the shoulders. And breathing deeply into the shoulders and breathing out. Letting the shoulders go. Moving our attention now to the throat, aware of the ability to swallow and speak, to draw breath into the lungs. And bringing attention now to the neck and the muscles there, the vertebra connecting to the skull, the neck holding the head, taking a breath into the neck and throat region and breathing out, releasing. Moving attention now up the back of the head, aware of the skull bones, the scalp, the tiny muscles of the scalp, aware of the follicles of the hair, and coming further up the head to the crown of the head, the top of the head. And now the forehead, exploring the sensations of the forehead. And moving into the entire face now, aware of the eyebrows, the eyes, the eyelids and eyelashes, the eyeballs resting in their sockets. Aware of the nose, the bridge of the nose, the bones of the nose, the nostrils. Taking a breath in through the nose, sensing and feeling the air as it comes in, perhaps cool, and leaving warm at the nostrils. Possibly feeling the movement of tiny hairs inside the nostrils. Aware of the cheeks, the cheekbones, the skin of the cheeks, and the many muscles of the face. Tiny muscles which give expressions to even the subtlest of feelings. Aware of the ears, the ability to hear, the outer ears, the inner ears, the process of hearing in this very moment. Aware of the jaw, the hinged joint on either side of the face, the muscles of the jawbone and the chin. Coming now to the mouth, to the lips, the inside of the mouth, the teeth and gums, the roof of the mouth, the tongue resting on the floor of the mouth. Aware of the brain inside the head. Breathing into the entire head. And on an out-breath, letting go of awareness of the head. Having scanned the whole body, spend a few minutes being aware of a sense of the body as a whole and of the breath flowing freely in and out of the body.